Todd Ellerin, Director of Infectious Diseases at South Shore Health. Doctor, thank you for being with us. Once again, we appreciate it.
Hey, guys.
So contact tracing is one of the big topics right now. It's all over the place. People are talking about it. The state is working with private groups to look at positive cases, and then they're going to trace who those people had contact with. Can you explain a little bit more about this and how all of this really works?
Sure. Maria, this is one of the basic principles about trying to stop an epidemic. You hear about we test, we isolate those who are positive, we trace contacts, and then quarantine. So what it means is if I'm positive, if I have COVID-19, someone talks to me about who are the people that I was in close contact with, generally within 6 feet for greater than 15 minutes. Usually you start for 2 days before the symptoms started. Okay, so you can imagine there's over 25,000 people so far that have been diagnosed with COVID-19. Okay, so imagine how many close contacts there are, about 100,000, hundreds of thousands. So this is a major, it's very challenging. But what the state has done is they've partnered with Partners in Health, who have about 1,000 people that are going to help, with this contact tracing. This is an amazing organization. So if they're behind it, we're going to have some success.
So Doctor, you just mentioned the 6 feet distance, and everybody's familiar with the 6 feet distance right now that people should maintain. But there are researchers who found that small particles produced by normal speaking can actually remain airborne for a while. What does that change, and how we're trying to slow the spread of the virus, if anything at all?
Yeah, so Ed, we still think that most transmissions are occurring within 6 feet. Just because you sneeze, and that sneeze could potentially travel 10, 15 feet, whatever it is, that doesn't mean that most transmissions are going to occur in that distance. So it's true. We think that certain coughs and perhaps can travel, the viral particles can travel longer in the air, but still we think most transmissions are within 6 feet, close contact.
In your opinion, doctor, how important is it that asymptomatic people are tested for COVID-19? And is there a bigger push for expanded testing? But the question is, where are you going to get the tests?
So this really makes this epidemic that much more challenging to control, because we know that asymptomatic infection, patients who are infected but don't have symptoms, can transmit a large proportion of this. So ideally, when we talked about those contact tracing before, we would also test those people as well, but we need lots of tests to make that happen.
And we're going through so much data right now, doctor, but and this is a grim note, I understand, but data shows that more people than normal are dying at home, and that has some doctors thinking the COVID-19 death count could actually be higher. As a doctor, what do you think about that?
I think this is really important. It's very sad, but I think this is probably multifactorial. I think some of it is reluctance to come to hospitals and to call providers, because we know that in our systems we're seeing lots of COVID-19 patients. But it's really important to reach out. The other thing is we think that there's an entity called silent hypoxemia, that's low oxygen levels when people may not have overt shortness of breath. So I think we have to pay attention to any even subtle symptoms and consider that a possible symptom for COVID-19.
Dr. Ellerin, thank you so much, Director of Infectious Diseases at South Shore Health. Great to have you with us, and great for you to share the information.
Thanks.